Hello and welcome to the National Academy for State Health Policy's informational webinar about the request for applications to participate in our upcoming Value-Based Payment Reform Academy. My name is Rachel Yelowich, and I'm a Policy Associate here at the National Academy for State Health Policy, or NASHP as we like to call it. Thank you so much to everyone for joining today's webinar. Over the next hour, you will hear more about the Value-Based Payment Reform Academy, what the benefits are to participating, and the application process. We will leave lots of time during the webinar for you to ask questions or get clarifications about the Academy or application process. I'd like to thank the Health Resources and Services Administration for their support of this work. Before we get started, a couple of quick housekeeping notes. Please mute your phone line for today's call. Please also do not put us on hold, or we will all hear your hold music. In order to ask a question, please type it into the chat box located in the bottom left-hand corner of your screen. Please note that if you are in full screen mode, the chat box will not be visible. I encourage you all to type your questions into the chat box as you have them. We will address them following this presentation. At the end of today's webinar, a short exit survey will pop up on your screen. We really encourage you to participate in that. It will just take a minute, and because your feedback really does guide our work. And lastly, a recording of today's webinar and the webinar slides will be posted to NASHP's website by early next week. Please feel free to share that with interested colleagues or folks you know who couldn't attend today's webinar. So to begin, for those of you who don't know us, NASHP is a 28-year-old nonprofit, nonpartisan organization. Our mission is to work with states across branches and agencies of government to advance, accelerate, and implement workable policy solutions that address major healthcare issues. NASHP has a long history of convening learning collaboratives and providing technical assistance to states, and we are really excited to continue that tradition of work with this academy. To start, the goal of the Value-Based Payment Reform Academy is to work with states to develop and/or implement value-based approaches to Medicaid reimbursement for federally qualified health centers and/or rural health clinics that align with your state's goals for transforming care delivery. The Value-Based Payment Reform Academy will select up to 6 states to participate to receive 12 months of targeted technical assistance. We are asking that state teams consist of 4 to 6 members, including representation from Medicaid, Primary Care Association, and FQHCs or rural health clinics, depending on your focus of the program. The other 1 to 3 slots on your team are flexible, and we encourage you to fill those with other key stakeholders in your state. We are seeking a wide range of state applicants with states that from diverse geographies, political compositions, and Medicaid delivery systems. We encourage states to apply that have an array of experiences with and readiness for payment reform related to federally qualified health centers or rural health clinics. Throughout this presentation and in the RFA, you've probably noticed that we use the phrase develop and/or implement value-based alternative payment methodologies. And this is to reflect our eagerness to work with states with a wide range of payment reform goals. We also think this leads to a more robust state-to-state learning opportunity. My colleague Jennifer will talk more about the application process and the technical assistance benefits of participating in this academy, which are great, in the later part of this webinar. I'd also like to draw your attention to the right-hand side of your screen and to note some key dates that are coming up related to the Value-Based Payment Reform Academy. Of particular note, April 1st is when applications are due. It's not an April Fool's Day joke. We really do need them by April 1st. And we will be starting technical assistance in early May. Technical assistance will run from May 2016 through May 2017. So there are lots of definitions of value-based payment out there, so we want to clarify NASHP is going to define value-based alternative payment methodologies for the purposes of our academy as the following. We're looking for methodologies that incentivize value over volume. promote the delivery of comprehensive, coordinated, and patient-centered care, methodologies that are linked to quality and efficiency, and lastly, meet the requirements of Medicaid reimbursement for FQHCs and rural health clinics under current federal law. I'm sure as most of you are aware, the Medicare, Medicaid, and CHIP Benefits Improvement Act established the use of the prospective payment system to reimburse these provider types through Medicaid. Under these federal regulations, states do have the option of establishing an alternative payment methodology in lieu of using the prospective payment system, as long as an alternative payment methodology is agreed upon by health centers and the overall payments made through the alternative payment methodology are at least equivalent to what the health center would receive under PPS. As long as states meet the requirements I just mentioned for alternative payment methodologies, we believe there is real and significant opportunity for states to move the payment reform needle for these providers. So why payment reform and why now? As you can see from the map images on your screen, delivery system and payment reform initiatives in Medicaid are spreading nationwide. NASHP has a state delivery system and payment reform map, which is where these map images came from. We actively track the implementation of these types of initiatives. So as of this month, 23 states are actively making Medicaid payments to medical homes, and 20 states are actively making Medicaid payments to health homes. Now, what's not pictured on your screen, but equally important, the Center for Healthcare Strategies reports that 9 states have active Medicaid accountable care organization programs, and many others are in planning. Additionally, 35 states and the District of Columbia have a CMMI State Innovation Model Testing or Design Grant, where states are, among other things, developing and testing various payment methodologies, including shared savings, shared risk, global budgeting, and episode-based payments. Since FQHCs are so critical to providing care to many Medicaid beneficiaries in our states, it's really important for FQHCs and rural health clinics to not be left out of state payment innovations. So, Oregon is really making great strides in reforming Medicaid payments to FQHCs. I wanted to share a little bit with you about their pilot program and all of the impressive work that they're doing. To read more about their work, you can look in our request for applications. Under the time of opportunity section, there's a bit more about the Oregon program, or follow the links on your screen when the slides are made available. In 2013, Oregon implemented a value-based alternative payment methodology pilot for a small cohort of FQHCs as a result of some FQHCs being interested in exploring payment models that better aligned with the medical home model of care. Medical home initiatives were in Medicaid, were and are still going on very much in Oregon. So instead of PPS, or prospective payment system, these practices received per member, per month payments. In order to make sure that the FQHCs received equivalent payments to what they would have received through PPS, the state did do a reconciliation process, and if they needed to, they made additional payments to these practices to ensure they received what they would have through PPS. And interestingly, since the total payments were equivalent to PPS, or the prospective payment system, the state reports that the pilot is cost neutral to Medicaid, which is very interesting. And Oregon has a lot of interesting work to share with our participating states. So I'd now like to introduce you to my colleague, Jennifer Rett. Jennifer is a project director here at NASHP, and she will give you more information about the many benefits of participating in the Value-Based Payment Reform Academy. She will also talk about how to apply. Jennifer?
Okay, thank you so much, Rachel, for that. Moving on to letting you know a little bit about the benefit of state participation in the Academy. There is a wide array of technical assistance and resources available to selected states over the 12 months of the Academy, including a range of individual technical assistance opportunities and peer-to-peer or group learning opportunities. I'll start by letting you know a little bit more about the individual TA opportunities. There will be support and assistance with developing a project plan, which will be a guiding document to help states map out their goals for this academy and how to achieve the goals during the course of the academy. There will also be access to expert consultation from national, federal, and state experts, and I'll tell you a little bit more about those in a moment. There will also be ongoing access to NASHP staff, including a dedicated NASHP staff person assigned to your state team. Over the course of the project, there will also be one site visit, including a visit from NASHP staff to your state. And the site visit will be driven by each state team's need. So for example, in previous projects, states have used site visits as opportunities to convene stakeholders to build support for an initiative. States have also used site visits as an opportunity to bring agency leadership and community organizations together to develop specific details of a project or to brainstorm solutions to a barrier that they may be facing. So those are meant to be really working meetings in service to your goals. And there will also be monthly calls with each state, and that will be dedicated time each month for your state team to meet to advance your project. Each state will define how it uses that time based on your needs. Examples from past projects are that state teams have used the time for a conference call or a webinar with NASHP, other states or experts to address a particular topic that the state might be facing. And state teams can also use the monthly call time as a dedicated meeting space to work together to advance their project. Rachel, can you assist me with advancing this slide, please? Thank you. All right, moving on to group technical assistance. There will be opportunities for state-to-state virtual learning as part of this academy. These learning opportunities will allow states to hear about the work that's going on in the other states, identify areas of shared need and interest, discuss emerging challenges, and to receive expert technical assistance on topics of shared interest. The topics for these opportunities will be developed over the course of the academy in reflection of the interest and focus of states. Prior to that, there will also be an in-person kickoff meeting. That meeting will be held either June 14th and 15th or June 23rd and 24th. The location to be determined based on the makeup of states that we select for the academy in part. And the application includes asking feedback on team availability for those dates because this is a required kickoff meeting, so we're going to try to schedule that in a way that is optimal. Funding is available for travel expenses for up to 4 members of a state team to attend this. The agenda for this will be developed collaboratively with the selected states. It will give states the opportunity to share their project plans and have discussions about various topics of interest with NASHP staff, state, federal, and national experts. There will also be time at this kickoff meeting for state teams to meet individually and to receive individual TA from experts as well. So the print here on the slide that you see before you is pretty small, but this is just to let you know that we do have a working list of on-call expert faculty that will be available who have shown great interest and support in this academy and will be available to meet as their schedule allows throughout the course of it. It is a list that includes Medicaid leaders, primary care association leadership, federal experts, and national organization leaders and health systems and provider groups. If you want to take a look at that list, which will continue to grow over the course of the project, it is available on our project landing page, and there will be links shared at the end of these slides. But if you just want to jump there, you can always Google NASHP Value-Based Payment Reform Academy, and you will find our landing page, which will have this on-call faculty list as well as all the other documents that you will need during the application process, like the request for applications and the application questions themselves. And as I mentioned, we'll continue to grow this list, and states should also not feel confined to this list at all in terms of what TA they would have access to over the course of this academy. If there are needs that emerge that aren't reflected in our current list of on-call faculty, NASHP will work to find you that additional expertise or contact that you might need to further your state's work. Moving ahead to the application. So required components of the application are assembling the state team. Rachel already mentioned that the core required components of your team will be senior Medicaid leadership, senior primary care association leadership, FQHC or RHC provider representation, as well as other members that might fill out your group depending upon the needs of your state. That might include other payers, such as Medicaid managed care organizations. That could include state data analytics staff, legislators, public health officials, or health policy advisors. So beyond the three core required team members, the remaining members are at the discretion of your project and your project needs. The other component, I'll jump ahead to mention the letters of support. So in some cases, it may not be feasible for a Medicaid director or a primary care association executive director to be really directly involved in a hands-on way in the monthly team meetings for this project. So in a case like that, where there still is support from a Medicaid director, we do encourage you to submit a letter of support that indicates that support from Medicaid leadership. So it is not required, but it is optional and really encouraged if you need to fill out your team in that sense. And then the other component of the application is the application questions themselves. Those also are available on the project landing page I mentioned, which you can access by Googling NASHP Value-Based Payment Reform Academy. Just to give you a quick overview of what those look like, the first section is listing your team members. It has spaces to fill in your team composition. There's a short section asking for feedback on team member availability for those dates for the kickoff meeting that I mentioned. And then there are 6 questions which are intended to get a sense of what your state's project is, as well as how that might fit into the context of any existing Medicaid payment reform efforts in your state, and especially, of course, those involving FQHCs or RHCs in your state. And also ask states to address the plan for achieving those goals within the 12-month project period. And I believe we have asked that the responses be limited to 5 to 6 double-spaced pages. We are not looking for extremely detailed answers necessarily, but just to have enough of the ground covered in the questions that we raise to understand your project and your goals and how those fit into the context of your state. In terms of evaluation criteria for applications, this is covered in more detail in the request for applications. But here you see the 4 key elements that we're looking for. We're looking for applications that are collaborative, and that refers to having a strong team in place with the appropriate leadership, a team that will demonstrate that there's an appropriate level of policy buy-in there on the ground. A history of collaboration across stakeholders would be really strong. Or if there, for example, are key team members that need to be included but aren't engaged yet, a strategy for bringing those players on board would help strengthen the application. We're also looking for applications that are transformative. And that means that we're looking for applications that can show, what it is that they're trying to change about payments to providers that will allow them to provide better patient care. The quality and efficiency-oriented criteria there is really to stay with this concept that we're looking for value-based payment reform. It's not simply about addressing cost, obviously. It's really about changing the system through payment in a way that achieves better quality and efficiency, and that is to say better value. And the last component is to make sure that the work plan and the project that's taken on is achievable. The 12 months is, of course, a very tight timeline for achieving anything related to payment reform. So this will depend upon where your state is, at what level your project is in terms of either designing or developing an alternative payment methodology or implementing one, possibly bringing a pilot to scale. That will be very individual based on each state, but we just encourage careful consideration of defining a component of the work for advancing value-based payment methodologies in your state that is achievable within a 12-month project period. So this last slide is just a quick summary of the application process. You'll need to assemble that core team and complete the application questions and submit those to Hannah Dorr here at NASHP. Her email is up there on the screen with that due date of April 1st. And states will be notified of selection by April 21st. And as of early May, we should have the definitive dates and location on that June kickoff meeting, and we will get things rolling. And right now, I will hand things back over to Rachel to address any questions that have been coming in.
Thanks, Jennifer. As Jennifer mentioned, we'll now move into the question and answer portion of the webinar. We have already gotten quite a few questions in through the chat box, and we will begin addressing those. However, I encourage all of you to continue to type in your questions about anything that has been discussed during the Academy or during this presentation related to the Academy or application process. We will address as many questions as we are able during this time period. So one of the questions that has come in is, if my state has CMMI State Innovation Model funds, are we eligible to participate? And that's a great question. You are definitely eligible to participate. I want to emphasize that this initiative is not connected with CMMI's SIM initiative. However, depending on your state, we envision possibilities where a lot of the work you are doing through SIM could be well tied to this Academy and could complement your efforts through SIM. Our Academy is open to all states that are committed to developing and or implementing value-based alternative payment methodologies for FQHCs or rural health clinics. So, and as a reminder, this Academy is supported through a cooperative agreement that NASHP holds with the Health Resources and Services Administration. So the next question that we have is NASHP looking for a target scope for a pilot in a state, such as a minimum number of clinics or any sort of requirements? And so The answer to that really is no. What your state wants to, what's your state long-term goals for payment reform for these provider types are, and then what discrete portion of that you'd like to work on during these 12 months. We are very open to a wide range of discrete work that states want to work on. For some, and we recognize that states are at varying levels of, in terms of the various stages of the process in terms of developing and implementing alternative payment methodologies. So for some states, we could envision them working on designing and building consensus on a specific value-based alternative payment methodology. For others, it could be developing a state plan amendment or managed care contract language should you want to work on value-based purchasing through managed care for these provider types. For others who are farther along, like it sounds like this state, it could also be bringing a pilot to scale, and we're excited to work with states on a variety of areas.
I'll take a quick question there. Someone was wondering what happens if a member of the core team cannot attend the kickoff meeting. In that case, we're just asking that people indicate their availability, and we will try to schedule accordingly to allow the most number of people to participate. And if there is a key team member, such as a Medicaid director, for example, that isn't able to attend on those dates, we'd ask that people please try to assign a delegate.
Sure. Thanks, Jennifer. So another question that has come in, a state wants to know that their primary care association represents the FQHCs in their state, as is common in states across the country. This person wants to know if having the primary care association participate on a state team would count for both the primary care association requirement and the provider requirement. So I would say we strongly encourage a representative or perhaps an administrator at FQHC or a rural health clinic that would be willing to participate. We feel that they would have great perspective in contributing to the development of your scope of work. However, if a month is not ample time to find a provider representative that's willing to participate, I would ask that in your application you leave that space blank and explain a strategy for engaging a provider to participate on your team if selected.
All right. We also got a question about who might be able to participate on the team in the other category. And the example here was regarding the possible participation by a private funder, and the example being that there are, in the state in question, a few foundations that are interested in participating, as they would be possibly willing to be involved in grant giving to fund value-based care, as far as I understand this question. The structure of these teams it's really meant to be a state team. Sorry, go ahead, jump in, Rachel.
Yes, I definitely understand the value in having a private funder participate in this initiative, and they might be able to support the development of a pilot. We're really looking for projects that can help make demonstrable policy changes on the ground. I think we would be open to having a private funder participate on the state team if it was meant to help the state defer costs to launching a pilot or developing something like that. But we really do require Medicaid support and participation on the team, as well as primary care association and provider representation in order to make demonstrable policy changes, demonstrable and lasting policy changes. Okay, and we have another question. It's a really good question. Are you requiring the Medicaid director to participate? The answer to that is no. We are looking for Medicaid leadership to be participating, so someone that it was within the Medicaid agency that has some decision-making authority and can represent the views of the Medicaid agency. That is one of the reasons why we are encouraging states to submit letters of support, because we recognize that Medicaid directors and primary care association directors and lots of other people are extremely busy with doing a lot of other great work in states. So we are very open to other Medicaid leadership participating, and if the Medicaid director would like to submit a letter of support of the work, that is strongly encouraged. So we have another question here, which is related to technical assistance, and how many hours of technical assistance can a state receive? And so that's a great question. NASHP does not place restrictions on technical assistance. In addition to the individual monthly calls that Jennifer described to you earlier, each team will have ongoing access to NASHP staff who can provide technical assistance or connect states with other external faculty as necessary in order to meet your state needs.
And there's another question here. Someone from a primary care association wondering if they're eligible to apply. And the answer to that would be yes, in conjunction with forming a state team with those other key team members that we discussed in terms of senior Medicaid leadership, and also including FQHC or RHC provider representation. So the key is to assemble that state team.
All right, so we have another question here, which is I think very good and timely for everyone. So in my state, we are at the beginning stages of thinking about value-based purchasing. Can we apply? The answer is definitely yes. And so as long as your team is able to secure support from Medicaid, the Primary Care Association, and your FQHC or Rural Health Clinic providers, and there is a buy-in and interest and commitment from folks in your state, we would readily encourage you to apply. So as I mentioned earlier, we anticipate applicant states will be anywhere from designing and developing an alternative payment methodology, building stakeholder consensus among key groups within your state, all the way up to developing and launching a pilot or bringing a pilot to scale if you have one already going on. So successful applicants, regardless of how far along you are in this work, will demonstrate in their applications how their proposed work will be transformative, how their long-term goals will demonstrate, how their long-term goals for payment reform will demonstrate how this will support transformed care delivery, and how the discrete portion of those long-term goals can be accomplished in the 12-month time period of this collaborative. And I believe that is the last question, and so we are just a few minutes past the half hour, and so we thank you all for participating today. We sincerely hope that you will all consider applying to participate in this collaborative. So to access the RFA and application materials, please follow the link that is just appeared on your screen. And we are, if other questions arise as you work on your application or you'd like more information that wasn't covered in today's webinar, please don't hesitate to email me. My email is also on this slide. And we will be posting a summary of the question and answer conversation that occurred today. And so please feel free to share the webinar recording and the Q&A with interested colleagues as you decide whether you are interested in applying and working on your application. As we close this webinar, please consider completing our very brief survey. It will help us improve webinars in the future. So with that, thank you again and have a great rest of your afternoon.